Well, I guess we'll get started, and hopefully those out in distant land on the phone or on their laptops can hear us okay. My name is Andrea Huseth-Zosel, and I am an assistant professor in the Department of Public Health at NDSU. I teach courses in social and behavioral sciences and public health and cultural competence for health professionals, in addition to an undergraduate course in Public Health 101. And an area of mine that I'm interested in and that I actually did my dissertation on is older drivers. So, but we also have Allison here with us.
Hi, I'm the INBRE graduate assistant, so I will be sitting with you guys and learning along.
Great. So why don't we get started? As I said, one of my research interests is older driver issues. And the reason I got interested, very briefly, going back to my history of research, the reason I got interested in older driver issues is that I actually was an associate research fellow at the Upper Great Plains Transportation Institute here at NDSU, and I worked for several years actually doing transportation safety research, and one of the topics that we focused on was older driver issues, specifically in the upper Midwest and even more specifically in North Dakota. So that's kind of how this piqued my interest in regards to research focus. So before we get into the older driver issues, I would actually like to frame the older driver issue topic in terms of a public health lens. And so I want to give just a little bit of background on the social determinants of health. Now, I'm not sure to what extent the audience has a background in public health or how familiar they are with the social determinants of health, but social determinants of health are basically conditions in which people are born, they grow, they work, they live, and they age, and that contributes to your overall health. So it's basically everything that we interact with on a daily basis. And that includes, but is not limited to, our social environment or societal characteristics, which can include potentially discrimination issues, income issues, gender issues. It also encompasses our physical environment, as we've previously stated, where a person lives or where they work, and can also include medical care, such as access to medical care, or whether or not a person has health insurance. So we can use these social determinants of health potentially as a lens to examine very specific public health issues. And in the case of the topic today, we're going to be using it to examine the issue of driving. And so when we think of driving, you probably have very distinct topics that pop or situations that pop into your head. We have, texting and driving is very much an issue now in transportation safety, where we don't want to drive distracted, and you can get a very expensive ticket in North Dakota for texting and driving. We also have drinking and driving. Obviously, this is not something that we would like to do, and again, in North Dakota, it's against the law. Everywhere it's against the law, but in North Dakota, you can get a somewhat hefty fine for drinking and driving. We have teen driving issues. Those that are just starting out, so they might be taking intro to driving courses or out on the road, our student drivers. It's also a very important traffic safety issue. Seatbelt use, whether or not we wear our seatbelts. It's very important to wear your seatbelt. And for those of you out there in video land, please do wear your seatbelt, because studies have shown it's very effective in preventing fatalities, traffic-related fatalities. And then also drowsy driving. This is also, I don't want to say it's a hot new topic, but it's something that's been researched quite a bit, and obviously it's something that's very important when we're talking about traffic safety and transportation safety issues. But what do we want to talk about? We want to talk specifically about older driver issues. So, and for older drivers, when I'm talking about an older driver, specifically I'm talking about those people aged 65 or older. That's the population we're looking at. So first of all, I want to watch a very brief video on what I want to set the stage for stereotypes of older drivers. Let me pull that up.
You are looking at that harrowing footage we first showed you last week. An 84-year-old woman speeding the wrong way down an interstate near Philadelphia. She said she was on her way to the dentist when she caused all that havoc on the highway, driving for several miles on the wrong side of the median. Although no one was seriously injured, she caused 4 accidents. And as Jeremy Hubbard reports, she has also sparked a new debate on whether some seniors should be stopped from driving.
She's barreling down the interstate as if nothing's wrong, an 84-year-old woman behind the wheel of this station wagon, oblivious to the oncoming traffic.
It was traumatic, you know, it was something I never thought I'd see.
Tim Fleming pulled out his cell phone camera to record the jaw-dropping sight on I-95 outside Philadelphia Thursday, desperately honking his horn, trying to get her attention.
I saw cars swerving around there, she wouldn't stop, and I yelled at her again, she just waved her arm at me, just like, leave me alone.
Amazingly, no one was seriously hurt, despite the 4 crashes she caused. Her road trip, a reminder of the dangers sometimes associated with older drivers.
Okay, so just setting the stage a little bit for some of the stereotypes that people might have about older drivers. What is interesting, though, is that this situation is not unique to older drivers. There are plenty of people that drive the wrong way down a street. It's just that because this woman happened to have been 84 years old, this is what makes it a newsworthy video. And so oftentimes I think we stereotype older drivers as being bad drivers, not having good judgment. I just want to set the stage that we all have stereotypes of older drivers, that we hold of older drivers, that it's not necessarily the way that all older drivers drive. And so to connect the dots, to connect our social determinants of health, driving, and older adults, going back to our social determinants of health, if we're looking at our social environment or our societal characteristics, going back to that discrimination piece, that tags along with the stereotyping that we might associate with older drivers. It's more likely to be in the news. It's more likely to, if an older driver has caused a crash, it's more likely to be on the front page of the newspaper. They're more likely to have their age listed than a person who's, say, 40 or 45 years old. Oftentimes it's not going to be a 40-year-old woman caused a crash going the wrong way down a one-way. It's more likely to be an 86-year-old woman caused a crash going down a wrong way on a one-way, versus if it were a 40-year-old woman, it would just be a woman happened, caused a crash on I-94 going the wrong way. They're more likely to associate their age with their actions than if they were any other age. In terms of income, specifically looking at poverty and older adults in driving, older adults who do live in poverty, who don't have much in terms of income, are less likely to have a vehicle, so they're less likely to drive, less likely to be associated with those older driver stereotypes. And gender specifically, we'll be talking about this a little bit later in the presentation. Women are actually more likely to stop driving earlier than men, and that could be a good thing in terms of aging-related changes that might affect their driving, but that can also be a bad thing, and we'll be talking about that as well. So in terms of a physical environment, where a person lives, specifically where an older adult lives and where they potentially are driving, can also be an issue in regards to public health issue. So for example, an older adult who lives in a rural area versus an older adult who lives in an urban area, the rural person has less access to public transportation. So they're almost required to continue driving longer potentially than they should be, than those who live in an urban area, potentially more likely to be involved in a fatal crash, unfortunately. And also in regards to medical care, specifically access to health care or the types of health care that's provided, physicians, I don't want to say often, physicians are a great source of information for older adults about aging-related driving issues. And unfortunately, if an older adult does not have access to health care, if they don't have health insurance, or if they live in a rural area and they don't necessarily have access to a physician, they might not be getting that information about maybe you should not drive at night, not drive in bad weather, maybe you should stop driving because of your aging-related physical condition. which is unfortunate as well. We would all like to hope that older adults, all people in the United States would have access to health, but those that do not have access to health care are not as likely to get this information from their physician. So why is driving such an important issue for older adults in the first place? I think those of us who are driving, those again in video land who drive, can look at their own situations. Mobility, we all like to get around, right? Especially in rural areas, if you don't have access to a bus, a subway, an Uber car, taxi, what have you. Mobility is very important for getting around, running those errands, doing what you need to do. Independence is often associated with our identity, right? We like to be independent. We want to be able to just get in a car and go. For older adults, studies have shown that older adults fear a loss of independence more than they actually fear death itself. So they would rather be dead than to lose their independence. And so to take their driver's license away, to make it so that they're no longer independent, no longer able to drive themselves around, oftentimes is worse than death itself. Convenience, very much related to mobility. We all just want to get into our car, go to the grocery store to grab a jug of milk, go to our friend's house, do what we need to do. Security is also a reason why driving is such an important issue for older adults. Older adults are afraid, I don't want to say all older adults, studies have shown that some older adults are afraid to take public transit by themselves. They're afraid of getting mugged, they're afraid of getting lost, they're afraid, there's just so many issues that can arise that they potentially might not feel like they can deal with, so they're less likely to take public transportation, they're more apt to take a vehicle. And so they shun public transportation. You can see that less than 3% of trips taken by older adults in the United States are actually by public transit, and that's including adults in urban areas. And finally, social connectivity. Being able to have a vehicle so that, again, you can get in your vehicle, drive to your friend's house, drive to your family's house, go see your grandkids or your children. It's very important to be able to stay connected socially for older adults, as it would be for any adult. Our population in general is aging, and you can see by the chart that when we have age 65 or older, it's projected to be about a fifth of the population by 2050, and currently it's about 13%. Currently, about 15% of the U.S. population is 65 or older, and about 81% have their driver's license. And by 2050, the population will be 65 or older, which, going right along with that would mean an increase in those who are still on the road as well. So what? That we will have this abundance of older adults on the road who are continuing to drive, who still have their driver's license. Why is this a big deal? Why do we care? This is where the specific public health issue comes in. Driving itself is complicated, and as a 43-year-old person, it is complicated. I have to admit, I do not like driving at night, especially do not like driving at night in the rain, because I can't tell the difference between headlights and the street lights and the stop lights, and there's all these lights flashing all over the place. I'm 43. Now I can't imagine my 84-year-old grandmother out on the road at night in a rainstorm trying to maneuver all of the transportation issues that confront her as she would go out in that environment. So driving is very complicated and involves a lot of physical, cognitive, and behavioral abilities. So why is it a public health issue? Aging-related changes, specifically physical changes and cognitive changes, can affect safe driving abilities, and we'll touch on that in a little bit. Which can lead to motor vehicle crashes, resulting in injuries or even fatalities for an older adult or for others on the road. But the consequences of stopping driving can be just as impactful as continuing driving, and we will also touch on these three issues. So what specific aging-related physical and cognitive changes can affect driving ability? Well, if we're thinking about driving, specifically the act of driving, thinking about if you have issues with your joints or muscles, just the simple act of turning the steering wheel or gripping the steering wheel, or if you have issues with arthritis in your ankles or something with your knee, that difficulty stepping on the brake or the gas, or even if you have difficulty shifting from drive to park, or if you have a manual vehicle shifting just to the different gears. And I have a brief video that demonstrates what it might be like to drive with severe arthritis.
Severe arthritis, which makes your joints swollen and stiff, is a very common problem for older adults. Arthritis can make it hard for you to get into and out of your car. Arthritis in your hands, shoulders, or back can make it harder to put on your seatbelt. It can also make it difficult to hold and turn the steering wheel. Arthritis in your neck can make driving risky. You may have difficulty maneuvering in traffic because you cannot turn your head to effectively check your blind spots.
So very briefly, you can see that, you know, just even trying to look behind you or to the side of the vehicle so that you can change lanes is very difficult. When you have even minor neck issues, and so joint and muscle changes can make driving very difficult. Cognitive changes, the chart here shows that as we age, we're more likely to, the prevalence of dementia increases. So this is just for the United States, but this is a global issue as well. And cognitive changes can result in less coordination and difficulty doing multiple things at once. So if you think about the act of driving, that you're in the car, you're steering, you're checking around you to make sure that there's there are no cars that are close to you, or if you're changing lanes, you're accelerating, you're braking. There's all of these things going on at one time, and so if you have dementia, it would be very difficult for you to focus on all of those things at one time. Also, difficulty judging distance and space. Although I have to admit, there are quite a few drivers in North Dakota that have a very difficult time judging distance and space. My husband being one of them, but following too closely is a very real issue. If you're driving on the interstate going 75 miles an hour and you're having difficulty judging how close you should be to the car in front of you, and the car in front of you all of a sudden brakes quickly, that you're obviously all in the back seat of that car in front of you. So being able to judge a proper distance between cars would be very important, but having dementia might make that more difficult. Also, difficulty processing information. So changes in light colors, going from green to yellow to red, you might not be able to process that. Or even, as we're discovering here in Fargo, it's road construction season, the multiple detours that you have to maneuver to get from one point to another. And if you're used to a particular route, and then all of a sudden there's a detour thrown up, if you have dementia, even minor dementia, being able to determine how am I supposed to maneuver around this detour route can be very difficult. And then just increased memory loss again. So if you're going out on an errand, you're going to West Acres, you're going to a local mall, and trying to get home again, oftentimes there could be difficulty in trying to remember the route that you are supposed to take to get back home. Vision-related impairments are also can also affect driving as well, and the chart shows that as you age, you're more likely to have some type of vision impairment, and if you look at those 80-year-olds, they're much more likely to have a vision impairment, and those types of issues can be glaucoma or cataracts, macular degeneration. It can make your vision either tunnel vision, or your difficulty seeing certain colors, or difficulty seeing directly in front of you. This can make it very difficult to see street signs, difficult to see pedestrians crossing the road, different cars crossing the road. It can also make it very difficult to drive at particular times of the day, such as at night when you have those multiple lights flashing at you, or in bad weather such as rain or snow. And so these changes, as we said, can result in an increase in motor vehicle crashes for this population. What we have here is a trend line of driver crash involvements, fatal passenger vehicle driver crash involvements, and this is from 97 to 2012, and this is really great chart. It shows that we're seeing declines in these fatal crashes, which is awesome, and we're seeing these declines in fatal crashes across all populations, all age groups, 35 to 54, 70 to 74, 75 to 79, and 80 and older. But if you notice, those 80 or older, they're still much more likely to be involved in those fatal crashes. So although we are seeing this decrease in fatal crash involvement, this particular population, the older adults, are still more likely to be involved in these crashes. Also, what we have here are the non-fatal passenger vehicle crash involvements. And so we see this kind of a U shape, and on one end of the U, you can see my mouse right over here, these are teen drivers, so 16 to 19. You can see they're also very much more likely than those in the middle ages to be involved in a motor vehicle crash. Then we have the U, and then it goes right back up again for those 70 to 74, 75 to 79, and 80 or older. And so, although we, go back again. Although we are seeing this gradual decline in these crash involvements, we are still seeing these particular ages having more of a proclivity to be involved in these crashes. So stopping altogether, we might say that, well, if we're having such an issue with older drivers or older adults and all of these cognitive and physical issues that can affect their driving, why don't we just have everybody just stop after a certain age? And there are reasons for that. There are consequences of stopping driving, and this is consequences of driving cessation, or why we would like to continue driving safely as long as possible. So if you have an older adult who stops driving, they're already marginalized due to their age, right? So we already have a concept of what older adults should be doing or should not be doing. They're already marginalized enough. If an older adult stops driving, there's obviously a significant decrease in out-of-home activities. They're less likely, to go to the grocery store, go to the doctor, go to the dentist, seek out these essential services, less likely to do social activities, less likely to go out into the community and do things such as go to a movie theater, go to the library, see friends or family. And that can be very horrible for somebody. I personally cannot imagine having those restrictions. And so a result of stopping driving can result in an increased likelihood of depression, decreased overall life satisfaction, poor functional status, such as self-maintenance activities, such as eating, bathing, dressing yourself. Oftentimes, older adults there's just a decline in their functional status after they stop driving. Greater cognitive decline, and now we don't know if the chicken or the egg comes first, if the cognitive decline results in less driving or less driving results in greater cognitive decline. But studies have shown that there is an association with stopping driving and the increase in cognitive decline. And then just that greater sense of dependency, which we've already discussed as earlier, that older adults would rather be dead than to lose their independence. So this greater dependency and loss of control can just be horrific for an older adult, or for anybody for that matter. Additionally, driving cessation can lead to declining overall physical health. Older adults who stop driving have been found to be 5 times more likely to enter long-term care facilities. Older adults who stop driving are 6 times more likely to die within 3 years of driving. And again, people who stop driving could already have declining health, but there is that possibility that driving cessation makes these declines worse over time and more severe. Although researchers are trying to tease those apart to see if they can determine if they can see which comes first, if it's the decline in health that leads to the driving cessation, or if it's the driving cessation that leads to the decline in health. So we'll just discuss a few things about what can be done about, in terms of public health interventions for older drivers. First of all, normalizing driving limitations and cessation, so making it a normal part of transitioning into older adulthood. Normalizing these early conversations about driving issues. If you're going to see your physician, We'll talk about that in just a minute. Providing alternative transportation options, especially in rural areas where they might have limited options in regards to, taxis or Uber or buses. And then using these driving modifications, which are pretty cool, we'll talk about those too, that allow older drivers to drive longer and much safer. So healthcare providers, what can our doctors do to assist in helping older adults drive safely? They are very uniquely placed in society to monitor these aging-related changes which can affect driving ability. We go in annually for checkups, and they're able to track vision, hearing, arthritis, or muscle changes, which might affect an older adult's driving ability. And they can provide information to their patients on these driving safety issues. They're very knowledgeable about how these changes in our bodies can affect our driving. And studies have shown that adults in general, but specifically older adults, are much more likely to follow their physician recommendations as opposed to a son or a daughter that tells them that they have to discontinue driving or that they should change their driving habits. Healthcare providers are a trusted source of information. And they have overall responsibilities to public health and safety, and as we saw earlier, this particular population has the proclivity towards being involved in more motor vehicle related crashes, and so just to have that discussion with their patient about how the changes that they're experiencing as they age might affect their driving abilities. Healthcare providers can be providing this information much earlier than when these physical and mental changes are actually occurring. This could help normalize these discussions. So for example, instead of waiting for an adult to be 65 or 70 years old, have these conversations started when they're 45. I'm already seeing changes in my vision. I don't wear glasses, but I'm already seeing changes in my vision. I'm 43. That I can definitely say will probably affect my driving at some point. I have a piece of paper in front of me and I have to hold it out so far. I can, my arms are only so long. But if we have these discussions with older patients before these changes take place, it helps to normalize it, right? So instead of discussing an issue with the patient when they're 85 and saying, sorry, Esther, you're 85, we're yanking your driver's license because your vision's gone real bad. Start these discussions at age 45 and say, well, Esther, I see that, your vision's starting to change a little bit. Just so you know, in a few years, you'll probably have to get glasses. And then 5 years after that, okay, Esther, I see that you have your glasses. However, let's start modifying your driving so that you don't drive as much as at night, because I see that this potentially could affect the way you safely drive at night. So instead of waiting until that red flag moment, start having these conversations and normalize the conversations earlier. This way, older adults can get prepared emotionally, because it can be a very emotional conversation to have with somebody that you're telling them that they can no longer drive. And logistically, especially if they have to find a friend or a family member to assist in getting them around to these doctor's appointments, going to the grocery store, doing the things that they really would like to do, they need to get prepared for that. And this can ease older adults into this driving cessation period, and it can really make it a more positive experience. Although overall, it's probably not the most positive experience to know that you are potentially not going to be able to drive in the near future, but it can make it a more positive experience. So in reality, if we talk about the self-regulation of driving, which would be how I regulate my own driving habits, in reality, we might have an independent driver who is 65 or 70 or 80, and they get into some type of a car crash or a motor vehicle related incident, and then at that point in time, they potentially are forced to stop driving. The end. And now their driver's license has been taken away, potentially. They're no longer able to drive. Depression sets in. It was a horrible way to transition into driving cessation. However, the ideal situation would be to have an independent driver who has consistent physician communication about driving issues that normalizes this transition, and then they transition from the independent driver to driving reduction, and from driving reduction into driving cessation at some point, as opposed to making an abrupt, immediate change without having any previous conversations about it. However, although physicians have been found to be a great source of information, and they are ideally placed in society to provide this information to older adults, research has shown that physicians are not likely at all to provide this information to their older patients. Research has shown, including my own research, that the top reasons that they are unwilling to provide this information is they say they have no time during the office visit, which is a valid, I don't want to say excuse, it's a valid reason. There are a lot of things that need to be discussed during an annual visit, and they have a very brief amount of time in which to discuss those issues. Another reason why physicians might be unwilling to provide this information to patients is that the family members might be resistant to discuss the issue because they do not want to be the ones to drive the older adult around. They don't want the responsibility in their hands of having to drive, their father or mother or uncle everywhere around town. They just don't want that responsibility. Or the patient is obviously resistant because they're in denial that they're having these changes that might result in stopping driving or reducing their driving habits. And going back to the dependence issue, the physician does not want the responsibility of contributing to a loss of independence for a patient. And this is especially true for patients in rural areas. Physicians are well aware that in rural areas, especially in rural North Dakota, there's just not the access to public transportation as there is in larger cities like Bismarck or Fargo or Grand Forks, and they just don't want that responsibility on their shoulders. So they could provide, communities can provide alternative transportation options, and obviously in some areas there are alternative transportation options. You have Uber in some places, there are taxis, some cities have buses, well, obviously much larger cities have subways, but these are not available in rural areas, and so that's obviously not an option for a large number of older adults in the United States. Then we have something called paratransit services or senior service options, where older adults can call up a particular service and request a ride or schedule a ride if they need to go to the doctor or the grocery store or whatnot. But there are a lot of issues with these ride services. Oftentimes there's a cost that comes with it, potentially a membership fee. Do you have to have a certain income for using the service? Do you have to be, do you have to be in poverty, or what type of an income is used as a factor for using the service? Will insurance cover the cost of the ride? Because oftentimes older adults, they just don't have the income to use the alternative ride services. And what other types of requirements do they need to qualify for this particular service? And how accessible is it? What is the specific service area? Is it accessible in rural areas? Is it only available for certain times during the day or certain days during the week? Do you have to call to make a reservation? Can you get a ride in off hours? Let's say it's during the evening hours and you needed to go to the emergency room, which potentially I guess you could call an ambulance, but let's say you just needed to go to the walk-in, you had a sore throat or whatnot. Are these certain ride services available in the evening, on holidays, on the weekends? All of these are huge issues with older adults in regards to ride services. So we have an example here in southeast North Dakota. It's the Metro Senior Ride Service, and it offers transportation options to several counties in southeast North Dakota. I'm just going to pop out here quickly. Here's the page. The Metro specifically offers rides to Fargo, West Fargo, Moorhead, and Dilworth. But I want to draw your attention to the fact that the rides are available mostly between the hours of 7:30 and 4:30 Monday through Friday, so very limited, and that you have to call and schedule at least 3 days in advance to schedule your ride. But you can schedule a ride up to 4 weeks in advance. There's a $3 fee for each way. You can also get a different ride service for grocery shopping, and you can see they kind of have a limited schedule for going to a local grocery store, Hornbacher's here in Fargo, and they leave from certain long-term care facilities. but if I can ask you to use your imagination, and I'm assuming that most of the people who are listening to this right now are independent drivers, if you wanted to go to the grocery store because you found out right now that you're out of bread and eggs and milk, and you have to call at least 3 days in advance to schedule a ride, does that seem like it would be a feasible option? And also there's a $3 fee each way, so it would technically be $6 for you to get a ride to the grocery store, potentially to get a jug of milk, some bread, and your eggs. I think we can all imagine how limiting that would be in regards to our independence. And I think we learned to plan very far in advance, real quick. But having to transition from being completely independent person, driving your own vehicle, being able to drive around town whenever and wherever you wanted, to having to schedule 3 days in advance to schedule a ride can have an effect on you psychologically. Then there are also the friends and family that we've been talking about. They're comfortable, they're familiar, you know them, you know that they're safe drivers. However, there are several reasons why older adults might not want to call friends and family to give them rides everywhere. They might not want to burden or inconvenience other people. They might feel like they owe things to this other person in exchange for a ride, like babysitting their kids, or maybe they owe them a meal, or that type of thing. Are people actually available during the times that you need them? Potentially not. And are people actually willing to provide these rides? Potentially not. And so these are all issues with using friends and family as alternative transportation option. So the vehicle modifications, there are several vehicle modifications that can allow older adults to continue driving safely in society. Sometimes older drivers actually stop driving too early because of these physical changes that we talked about, the vision issues, the arthritis issues, the muscular issues, and women are especially at risk should be stopping driving before they have to. And these specific modifications that older adults can make to vehicles can actually allow them to continue driving safely much longer. In regards to vision impairment, there are a plethora of things, and I had no idea that these can actually be aftermarket additions to your vehicle, so that even myself at age 43, I could actually get some of these on my vehicle to assist me with driving at night and in the rain. You can get non-glare panels so that if you are driving at night, the street lights and the stop signs aren't so bright in regards to your vision. You can get different types of side mirrors so you can see farther out into traffic. You can get different headlights so that you can actually reduce the glare from oncoming cars. You can get different interior lights, these aftermarket lamps, to help you see better within the vehicles. And mirrors to help blind spot detection, so additional mirrors, not just the side mirrors, but you get additional mirrors beyond that. And then a sun visor extender, which I think every car needs. This is in the bottom right. You can actually have a sun visor that pulls down, so it's almost like an extra pair of sunglasses that you can have. And then the extendable visor, which I know some vehicles have, but some vehicles only have it on one side of the visor or the other. And so you can actually get this for both sides, the driver and the passenger. In regards to hearing impairment, you can get aftermarket hearing impairment modifications made as well. So I think this sounds familiar, but you can get this so that it is actually at a louder volume, increased volume. Yeah, stop that. That's kind of annoying. But we're all familiar with those sounds. But somebody who has hearing impairment, if it's not at a high enough volume, they might not be able to hear it. So you can actually get it so it's at an increased volume, and you can actually also get visual screens added as well, so that you can see if something's happening to the vehicle. If you're not wearing your seatbelt, if you can't hear the door ajar noise, you can look at the screen, and the screen might very well tell you that you're not wearing your seatbelt. Please put your seatbelt on. In terms of arthritis or muscular issues, there are a lot of steering devices that you can can get. So if you find it difficult to grasp the steering wheel, you can get things that are called spinner knobs or lollipops that actually are, they look just like a little round lollipop, and it might be easier to grasp the lollipop than it is to grab the entire steering wheel with your hand. You can get different steering wheel covers that might have different feelings or ridges. It might make it easier for you to grasp. Voice activated systems, joystick controls, hand controls for braking. So if you're having issues with braking or accelerating because of ankle issues or knee issues, you can actually get hand controls for that. Pedal extenders potentially so that you don't have to push down so far, again, if you're having issues with your ankles or your knees. Extension handles for your steering columns, and even a wider ignition area. And I think we all have issues with trying, I do anyway, of trying to get your key in the ignition or trying to find these different controls that are around your ignition area. You can get a wider ignition area to make it easier to find these different controls. There are a lot of disadvantages to using these assistive devices, however. Potentially the device might not be used correctly. I mean, some of these devices are fairly complex. Obviously the visors potentially might not be, but if you're using a hand pedal or a hand device to brake and to accelerate, that might be a little more complex than if you're used to using your feet. And so the device itself might not be used correctly. You could get a false sense of security that you're an awesome driver because now you're equipped to drive at night and in winter and you have all of these cool accessories. So it might provide you with this false sense of security when in actuality you still should be maintaining driving the speed limit, still trying to be vigilant when you're driving. The devices themselves might be inappropriate for a driver. Potentially the hand controls, again going back to the braking and accelerating with these hand controls, it might be inappropriate for somebody who just can't get the hang of using their hands to stop and go because they've been doing the foot feet for 70 years. So it might be inappropriate for a specific driver. And it could change driver behavior. They could become very dependent on the device. So potentially they might have an aging related change that they're only experiencing for a certain amount of time. Let's say it's immediately following a surgery, and so they only need this device for a particular amount of time, but they might become dependent on a particular assistive device, and so it could change their driving behavior. Some barriers to using these assistive devices is that some people aren't aware that they're actually out there. And if their physician isn't telling them about it, or if they don't have an occupational therapist that's telling them about these devices, I'm not even sure where you would get that information from. Sometimes the cost is prohibitive. Obviously, thinking about putting an aftermarket technology into a vehicle, that sentence in and of itself, I just see dollar signs on either side. I mean, the cost, I don't know what the cost is, but the cost can be prohibitive too, using these assistive devices. There could be limited access to these sources. So even in Fargo, I have to tell you, I don't know where specifically you might be able to obtain these aftermarket devices. A larger city such as Minneapolis might have more resources for you to obtain these types of devices. There could be limited access to occupational therapists or driving rehab experts to install these specific devices or to provide training so that you can get trained on using these devices and actually are able to drive on public roads with them. And oftentimes there can be negative perceptions of these devices that go along with these aging-related changes. People have a negative perception of aging-related changes, and then by default a negative perception of these devices, which potentially could be a positive thing and allow them to drive longer, safer. There are also many driving classes, and actually even in North Dakota these classes are being offered. AARP and AAA offer online and in-person courses for older adults to brush up on their driving abilities and to get tips and tricks on driving in certain situations, again, like driving in bad weather or driving at night. So it's really great. Actually, my in-laws just went through the AAA course online, and they got a reduction in their monthly insurance rate. So if there are any older adults listening, that could be a way to save money. So just to wrap up, this is just kind of the tip of the iceberg in regards to the different issues that we can be talking about when we're talking about older driving issues. Driving for older adults, it's important, it's complicated, and it's very nuanced, and we didn't really get into the nuanced perceptions of driving for older adults, but it's definitely a very nuanced public health issue. So you have the two issues almost just opposed to each other. You have do you allow older drivers to continue driving with their aging-related changes? Do you require them to stop driving at a certain point? At what point do you provide these interventions for them? Are they cost-effective? I mean, we could go on and on. How do we normalize conversations about these aging-related changes, the changes in driving that will potentially occur, and the potential of using these specific modification tools, which I think are just really cool. And I would love to have somebody come in and provide a demonstration of some of these tools. Overall, how do we decrease the negative stereotypes about older drivers or aging in general, I guess would be the key question. And how do we increase these alternative transportation options for older adults? How do we get them to use these different transportation options and change their perceptions that they're definitely a safe and valid way to travel in the community? And how do we increase these options specifically as we're talking about North Dakota for older adults in rural areas? There are just a lot of issues related to older adults and driving for older adults, and I hope I provided some information that you found useful. This is the topic that I'm quite passionate about. So